It is the opinion of those who best understand the physical system that if the physical laws were strictly observed from generation to generation, there would be an end to the frightful diseases that cut life short and of the long list of maladies that make life a torment or a trial, and that this wonderful machine, the body, this goodly temple, would gradually decay and men would at last die as if gently falling asleep. By Mrs. Shedrick. Now, folks, I just want to just re-emphasize that when we are talking about health and we're talking about natural laws, we are also, we are not by any chance ruling out medical expertise and a lot of great doctors and great science and great discoveries that have come as a result of the dedication of these professionals. And I'm not just saying this for saying sake. I truly am a recipient of that. If you ask anyone who has grown up in a third world country and who has survived past the age of 5 years, I would have to say over 90% of them was because of good medical treatment, whether by vaccinations or by swift, prompt treatment of infections. There is a lot we have to deal with, and medical science has played a huge role in our survival. However, it is not enough anymore, and it's becoming more and more evident that we have to incorporate the other aspects of health in order to live long, healthy lives, especially in this third world country, and especially in the developed countries, where there are so many more things that the body has to deal with, everything from toxins to chemicals to technology, radiation, and all those other things. So we want to encourage you to listen closely to what is going on. Get your notes and your pens, and be sure to ask questions towards the end. And we're going to discuss this topic on heart health, specifically the anatomy of a heart attack and what you need to know to prevent one with Dr. Lundell. And I'm going to hand this over to Dr. Lundell, and as he sets up, I will be reading his bio. Okay. Dr. Lundell's experience in cardiovascular and thoracic surgery over the last 25 years includes having performed over 5,000 coronary bypass operations, certification by the American Board of Surgery, the American Board of Thoracic Surgery, and the Society of Thoracic Surgeons. Dr. Lundell was a pioneer in off-pump heart surgery, reducing surgical complications and recovery times. He is in the Beating Heart Hall of Fame and has been listed in Phoenix Magazine's Top Doctors for 10 years. He has been recognized by his peers as a leader and has served as chief resident at the University of Arizona and Yale University hospitals, and later served as chief of staff and chief of surgery at hospitals in the Phoenix area. He was one of the founding partners, of the Lutheran Heart Hospital, which became the second largest heart hospital in the U.S. and is now owned by Banner Health. As a recognized leader in his field, Dr. Lundell has consulted and advised for a variety of leading medical device manufacturers, such as Cardiothoracic Systems, Inc., before and after its acquisition by Guidant Corporation. He advised St. Jude Medical on tissue valve implantation and marketing. For AMED Inc., he consulted on, conducted, and published the first clinical study on miniature pumps for heart support. He co-authored a clinical study validating key technology for Coalescent Surgical, which has subsequently been acquired by Medtronic Inc. Dr. Lundell enjoys time with his children and grandchildren, and he competes in triathlons. He is the 2008 Ironman Arizona champion in the 65 to 69 age group, and he came 10th in the Ironman World Championships in Kona, Hawaii. Wow, what a list of accomplishments. Folks, it is with great honor that I present to you Dr. Lundell. Thank you, Dr. Lundell, for joining us.
Oh, thank you so much, Dr. Ajibade. I appreciate very much being here, and I appreciate everybody who's joined us tonight, and I hope it is a rewarding experience for all.
Absolutely.
The anatomy of a heart attack, and as Dr. David has told you, I do know a little something about a heart attack. I dedicated my career to the treatment of heart disease, and because it was such a challenge and because coronary bypass surgery was brand new as I was a medical student, it really excited and captivated me. The opportunity to save lives, to improve lives, to make things better really captivated me. So today we're going to talk about the anatomy of a heart attack. You know, what is it? How does it happen? What causes it? And most importantly, how to prevent it. If I can make the slide move.
Sometimes you might have to right-click and then select next to get it moving.
Okay, we got it going. All right. One of the important symptoms of heart attack is chest pain, and often the chest pain will come up into the jaw or down in the left arm, and it can be this can come from a heart attack or just from the heart starving for oxygen before a heart attack occurs. Now, what a heart attack really is a sudden onset of a total blockage of an artery feeding the heart muscle, and this results in the death of some of that heart muscle, and it's not a very pretty sight. You can see here that there's a clot in the artery down the front of the heart, and you see the area that's bruised. Looks like it's bruised, but it's really had this part is starved for oxygen because this artery's been blocked, and so this tissue is either dead or dying. You see the discoloration here and here, and that's really what a heart attack is the death of heart tissue. And when we lose some of this heart tissue, we lose the function, and most importantly, it could cause our death. And the most often the cause of death after heart attack is a condition called ventricular fibrillation. Now, normally you see that the electrical current that runs the heart comes from the upper chambers and goes into the lower chambers and causes a beautiful synchronous contraction of this miracle, the heart muscle. And both the left and the right ventricle will contract synchronously, moving the blood through the lungs in the case of the right heart and through the rest of the body in terms of the left ventricle. Well, if some of this tissue dies and becomes irritated, we get a condition called ventricular fibrillation. And it's not a pretty sight. It takes this heart from a beautiful synchronous muscular contraction to just sitting there quivering with the little muscle fibers firing independently, and no blood gets pumped, and we can't last very long into that condition. And fortunately, I see defibrillators. You see in the airports and lots of other places AED, which means automatic electrical defibrillators. And thank goodness for those. They've saved a lot of lives. And what happens is we give a shock with that defibrillator, and it synchronizes all the contractions of the heart muscle. And if the damage is not too big, then we can recover from the damage done by the death of this heart muscle, depending on how big that damage is. If it's a huge piece of damage in the left ventricle, sometimes it turns to scar tissue and turns into an aneurysm, which ends up causing heart failure. In very, very bad circumstances, this muscle will get so damaged that it sort of dissolves, if you will, and we can have a rupture of the heart, or we have a condition where the wall between the two chambers here gets a hole in it, and the blood goes across, and all sorts of horrible things can happen as heart muscle dies. So it's not a happy thing. It's not something that we ever want to happen. But in fact, it does happen, and the sad facts are that about every 63 seconds somebody dies of a heart attack in this country. Every half a minute somebody has a heart attack. 2,600 people died today of heart disease, and there were no headlines. I looked carefully. There were no headlines in the newspaper, on the electronic news, anywhere about heart disease. Can you imagine if 2,600 people died in an airplane crash? The headlines would be screaming.
Mm-hmm.
Now, when I started medical school, and for a good portion of my career, our understanding of heart disease was what we call the plumbing model, and that is the atherosclerotic plaque would just slowly build up in the arteries, much like the corrosion might accumulate in the plumbing of your home. And this is how we understood it, and we understood that this plaque built up in our arteries because we had elevated blood cholesterol. And so for most of my career, the whole focus on treating heart disease has been on lowering cholesterol by medication, by eliminating fats in the diet, and then of course when the plaque got too bad or when the circumstance was right, then the surgeon would be called, and that was me, and we did this coronary bypass operation some 5,000 times, and of course we have angioplasties and stents in order to squash and squeeze this plaque out of the way. As I say, our idea has been a plumbing model, if you will, and so I was just basically kind of a sophisticated plumber, if you will. The risks were higher than fixing the plumbing in your house, and much more significant, but basically I was just a plumber detouring around block spots and arteries. But the interesting thing is, in spite of the fact that our total focus is on cholesterol, out of 137,000 people admitted to U.S. hospitals in 2007, 75% of them had normal cholesterol levels. That should tell us really that something's wrong with this theory that cholesterol just accumulates in our arteries because of elevated blood cholesterol. Well, the knowledge slowly came, and in the late 90s we began to understand a little bit more about what really was the cause. And the knowledge that something else was involved began to appear in the very late 90s in the medical literature, and then in 2004 with this cover of Time magazine indicating that inflammation is really the link between heart attacks, cancer, Alzheimer's disease, and some other things. Now, this is interesting because if we didn't have inflammation, we would die from every infection or injury that came along. We need it. It's essential to our survival. Now, so this is really what happens in all of those heart attacks. It's inflammation. People have no symptoms because this plaque didn't obstruct the narrowing, and then finally inflammation caused this plaque to burst and close off the artery, and folks, that's a heart attack. You saw it happen right there. Now, inflammation, what has that got to do with it? As I said, inflammation caused the plaque to start, caused it to grow, and finally inflammation caused it to rupture. Well, let's just take a very brief look at inflammation and see what it is. We've all had it. The 4 cardinal signs of inflammation, Dr. David can tell us. I'll give him a test.
Let me try. It's redness, pain, swelling, and loss of mobility.
And warmth, yeah. And functional lesions. There are 5 things, but we always say 4. And, you know, it's in the Latin calor, dolor, rubor, and functionalesia, right?
What's that? Okay, that's
well, that's loss of function.
Okay, got it.
Calor is heat, and dolor is pain. Anyway, so it's pain, swelling, warmth, and redness. And so here's a very simple example. If we get stuck with a splinter, it brings into our body bacteria and dirt, which our immune system would recognize as abnormal. The immune system then sends out a cascade of chemical signals called cytokines. And these cytokines circulate throughout our blood, and they tell the blood cells that there's a problem. And they tell our white blood cells there's a problem. And they recruit these white blood cells to leave the blood vessel, come out in the tissue, and fight this battle. And what they do actually is end up eating the bacteria, as you can see here. The macrophage becomes an aggressive cell, and it actually eats the bacteria in order to destroy it, eats the dirt, and then very soon the cytokines signal this process to begin to clean up the mess and to heal. And so all wounds, all acute wounds, unless we get overwhelmed with an infection, the natural process is for them to heal. Well, the artery, as I say, changes when these cytokines go into the circulation, and they change because the very nice little thin single cell layer lining of the blood vessel, called the intima, becomes sticky to try to trap these soldiers and tell them to come out into the blood vessel wall or the tissue and begin to fight this battle. Now, cholesterol is a completely normal substance. We need it. It's part of every cell wall. It's part of the backbone of lots of hormones, and we absolutely need it. And a white blood cell would recognize it as abnormal and leave it alone, except under two circumstances. If we have an activated white blood cell, activated by these cytokines from inflammation somewhere, and it recognizes cholesterol as abnormal, either having been oxidized or having a sugar molecule attached to it, which is called glycation, then we actually can measure antibodies to LDL cholesterol, a normal substance. It gets changed by these two conditions, oxidation and glycation. In that case, this white cell recognizes it as abnormal, and it does what white cells are supposed to do. It eats it. It can't dissolve it, and so it becomes what's called a foam cell, because under the microscope it looks like it's full of foam bubbles. And a collection of these foam cells becomes what's called a fatty streak. And this is the very beginning of heart disease. A collection of these foam cells in the lining of the blood vessel, not in the channel, but in the wall of the blood vessel. And this is another view, and if you open an artery and look back, it actually looks like this. It looks yellow. I've seen this thousands and thousands of times, all the way from little streaks to big messes that we scoop out almost in the handfuls. But this is the beginning, and sort of the scary thing, Dr. David, is that 100% of 20-year-olds who died from accidents or other causes had a fatty streak somewhere in their arterial system. So this disease begins in the young, and we're beginning to see it more and more often in young people than we have in the past, which is a scary thing.
When you say 100%, Doc, are you talking about healthy as well as sick people? Are you talking about across the board?
I'm talking about across the board. These are 20-year-old people who died from accidents or suicide or some other cause. They weren't caused by illnesses of any kind.
Huh.
So it is a frightening concept that this actually is going on, and what that means is that each and every one of us has got a little bit of this in our own arteries. And you know, I've had a couple of examinations, and I've got a little calcified plaque in my aorta, and then a little bit in the right coronary, which should be Pretty usual for someone of my age, but fortunately it's only a little bit, and there's no significant narrowings anywhere in the blood vessels. But so it begins as a fatty streak, and then this next slide shows how things progress all the way from a normal artery, once again with this very delicate lining layer called the endothelium. And then the white cells end up going through the blood vessel wall when inflammation occurs and the cytokines circulate. They end up consuming the LDL and becoming a foam cell. A collection of these foam cells then becomes a plaque. Now, the body always tries to heal, and so if inflammation settles down, then fibrous tissue, like a scar, will form over the top of this plaque, and actually will slowly shrink down and get a little better. However, if inflammation continues, then that fibrous plaque becomes soft and dissolves, and we have what we saw in the little animation. We have plaque rupture, and we have a clot forming in the blood vessel that gives us a heart attack. So here you see in this one picture going all the way, and obviously this might take many years, or it might take only a shorter period of time, depending on how severe the inflammation was. But inflammation is really the key, and the only reason that any of this LDL would ever get in the wall of the blood vessel is because it's consumed by this white cell who recognized it as abnormal after having been activated by the inflammatory process. So this in one picture is all the way from a normal artery to a fatal heart attack. And I want to talk about this endothelium again. It's one single cell layer thick, but really it's the brains of the vascular system. This single cell membrane causes the blood vessel to constrict and to dilate. It controls blood clotting. It controls a lot of things, and so we call it endothelial function, and it really, this layer affects the muscular layer and all the rest. So it's really the brains of the system, and it's so very delicate that anything we do to irritate it causes problems. And we know that inflammation is a response to injury. And if we injure this endothelium, then we begin to have the problems that we've been talking about of heart disease. And inflammation not only affects the blood vessels, but how many of us out there have got a sore knee and we're blaming it on running or some such? Well, if it wasn't for inflammation, we wouldn't have these things. So if we have chronic inflammation going on somewhere else in the body, we can actually find white blood cells in the joint of our knee. And these enzymes come and they digest the collagen, which is the lining layer of our joints, and tissue gets destroyed. And so this is how inflammation affects not only the heart, but gives us arthritis and lots of other degenerative problems.
Doc, one question that might come up, I'm sure maybe in someone's mind out there, is this: if inflammation happens all over the body, and there are blood vessels and endothelia all over the body, why is it that a heart attack, I mean, we don't have foot attacks, or we have brain attacks or strokes, but why is it the heart that why does it happen in the heart, and why is that so fatal?
Well, anytime I'll go back to it. I guess I didn't explain it good enough. Acute inflammation we need is the response to an acute injury. Chronic inflammation is a response to a chronic injury. That is a small little injury we receive every day on a daily basis, and we never get a chance to heal. And if we do something that irritates our blood vessels every day, or if we have a chronic infection somewhere that's constantly pouring out these cytokines, then the oxidized LDL gets consumed by those white blood cells that are activated, and gets deposited in the blood vessel wall, and then eventually this builds into a plaque. The plaque then can rupture, and that's what gives us ultimately a heart attack or a brain attack, which is a stroke. Is the sudden closure by a ruptured plaque.
Mm.
And it's not just the debris and the cholesterol in the plaque. It's actually a blood clot, and that's why you hear about getting clot-busting drugs both for strokes and for heart attacks, for that matter.
Mm-hmm.
And if we get we don't get a sudden attack in our knee, for example. This is just a chronic process that keeps going on because there's number one, our life doesn't depend on our knee unless we have to run away from something. And so that's really the difference, is that, yes, the chronic inflammation is the same. The consequence is different because if our knee suddenly gives out, we fall down, we don't have a heart attack and die.
Mm.
So I've touched on acute and chronic inflammation, so let's take a look at what might injure us chronically. And by that I mean a little injury every day. And you touched on our complicated environment with lots of chemicals and toxins and this and that and the other, but common things occur commonly, and the biggest injuries, in my opinion, that we can change easily are these four. And these four, in my opinion, are the biggest causes that injure our arteries and cause chronic inflammation on a daily basis. And that's the over-intake of simple carbohydrates, the over-intake of vegetable oils, a deficiency of fish oils, and oxidative stress. Now let's take simple carbohydrates or sugar first. 100 years ago, the average American ate about 10 pounds per year. We now average 170 pounds of sugar per person per year. Stop and think about that, folks. That's a half a pound a day of sugar.
Wow.
And somebody's getting part of my share, and and how did we get in that circumstance? Well, starting in the 70s, we were advised to eat a low-fat diet, and of course, food makers jumped on that bandwagon, and they made lots of low-fat foods, which were high in carbohydrates, high in sugar. We have low-fat crackers, we have low-fat this. And something as simple as low-fat milk, if you look on the label, you'll see that the carbohydrate content is much higher than whole milk. Yes, whole milk has a higher fat content, but the carbohydrate content, meaning the sugar content of skim milk or low-fat milk, is much higher than regular milk. Now, just to illustrate that sugar injures the arteries on a daily basis, consider what happens to the poor person with long-term diabetes. They lose their kidneys, they go blind, they lose their limbs to amputation, and they die prematurely of heart disease. So there's definitely a connection there between the injury caused to that delicate little lining layer of our arteries and having high blood sugar. Now, I snuck into Dr. David's house last night, into his pantry, and took this picture.
Oh, no. Oh, no.
Just kidding, folks. But it's just to illustrate sugar is everywhere, and we got snacks sitting in our workplace, we got snacks at our desk, we got snacks in our house. We got all this food with every bit of it sugar, from crackers to candy bars to everything. And one of our biggest sources of added sugar in our diet would be a Coke. And there's not a mother out there, I don't think, that would let her child sit down and eat 9 teaspoons of sugar from the sugar bowl. But there are mothers out there who have allowed their child to drink a regular soda pop, which contains 9 teaspoons of sugar. So stop and think about it, folks. Here's where we get a huge portion of our added sugar. And once again, it's everywhere. It's crackers, it's cookies, it's snacks, it's bakes and bagels, and it's low-fat this and low-fat that, which gives us all the extra sugar. And that's really a significant cause of, number one, injury to the arteries, and number two, chronic inflammation. Well, how did we get there? Once again, we got there because we were advised to eat a low-fat diet. And we were advised to avoid all saturated fats and animal fats of any kind. We couldn't have bacon, we couldn't have eggs, we couldn't have steak, we couldn't have meat. It was going to kill us. Cholesterol is the killer, according to this Time magazine article. And this goes clear back to 1954, when we first started, not that far, 64, when we started talking about this. We were told to avoid these animal fats, and we were told that instead we should consume polyunsaturated vegetable oils, which were supposedly healthy for us. But these things have never been part of the human diet. They contain large amounts of omega-6 free fatty acids. Now, because when you hydrogenate these oils, they never spoil all the goods we make with them, baked goods and cookies and Twinkies, French fries. We use the corn and soybean oil for cooking everything and baking everything, because we were told it's healthy, all vegetable, it says, none of that evil animal fat. Well, the omega-6 overload is a significant source of inflammation. And as an example, we can measure the level of omega-6 in tissues. And if we look at the country of Greenland, we see the average tissue level of omega-6 is 30 units. And we look at the heart attack death rate of 20 per 100,000. If we come to America, where we slightly more than double the omega-6 level on our tissues, we have 10 times the heart attack rate. There's a direct connection, because we know, not only by this observation, but we know by biochemical studies, that an overload of omega-6 produces pro-inflammatory cytokines, which then needlessly activate the white cells and start this cascade that we talked about before. And it's about balance. We do need a little bit of omega-6 in our diet, and we should be equal amounts with omega-3 from fish oil, but we get so much of this in our cooking and our prepared foods that our diet now is about 20 to 1, whereas it should be 1 to 1, omega-3 to omega-6. Which brings me to omega-3, and from fish oil. It's really nature's most effective anti-inflammatory. Whereas omega-6 is metabolized to pro-inflammatory cytokines, omega-3 is metabolized into anti-inflammatory cytokines. And omega-3 works in many pathways. Unlike a drug, which is targeted to one spot in the metabolic pathway, omega-3 works in many areas just to cool down the fires of inflammation without interfering with our ability to fight off an infection or respond when we need to respond. Omega-3s have been shown to stabilize that plaque, to help prevent it from rupturing. It's been shown to reduce the risk of heart attack by up to 40%, sudden death by more than 50%. And the news yesterday and the day before had some silly study out of Europe where they gave people omega-3 enhanced margarine, and the headlines said it didn't prevent heart attacks. Well, it was not a very well done study. It was on older people who had had a previous heart attack, and the dosage of omega-3 was relatively small. So the headlines misled everybody, saying omega-3 doesn't prevent heart attacks, but in truth, it was a very small dose on people who already had significant heart disease, and so the numbers just weren't big enough to demonstrate any benefit.
And margarines, I mean, margarine is that's a lousy
it's a lousy vehicle to carry the omega-3, right?
Right.
It's like you know, putting your diamonds in a junk cart, you know. So I think that's a good thought, Dr. David. Omega-3 not only benefits the heart, but it helps with high blood pressure, irregular heartbeats, brain development. Folks who get good doses of fish and fish oil have less Alzheimer's disease. It's a lot of work on treating depression with omega-3. Folks with arthritis can cut their pain medicines in half by getting a significant dose of omega-3 from fish oil. And it's been shown to improve folks with diabetes. And the last thing on our list that causes injury every day was oxidative stress. Once again, it's about balance. Now, everybody out there likes oxygen. I know I do. And as a consequence of using oxygen to live, we make free radicals every day, especially in this little mitochondrion, the factory of energy in every cell. So we produce tons of these free radicals every day, all the time, as a natural consequence of living. Now, I'll take you back to your high school chemistry, and a free radical is just a molecule that's missing an electron. And so when we take an oxygen molecule and put it through the mitochondrion, it strips an electron off to provide the energy for the cell. A free radical, or a molecule missing an electron, is pretty unhappy, so it becomes a thief, and it goes out and grabs one from its neighbor. Its neighbor then becomes unstable and goes out and grabs one from its neighbor. And so the cascade goes on, and left unchecked, this is how oxidative stress occurs and how it can damage DNA, it can damage the cell, and it can actually lead to cell death if it's not combated by enough antioxidants. Now, antioxidants is a molecule that can donate an electron and still remain stable. And that's what makes them unique. They can donate an electron and remain stable. So not only do we make free radicals naturally, but we get lots of them from our environment. We get it from ultraviolet light, from radiation, from air pollution, from smoking cigarettes, which I hope nobody does. But with lots of other things, and one of the consequences is that the ends of the DNA and the RNA, called the telomeres, end up being shortened and get damaged. And so this is one of the theories of aging, is that we slowly damage our DNA by oxidative stress, and the cells can then no longer reproduce. We now know that inflammation not only causes heart disease, but strokes, high blood pressure, Alzheimer's disease, depression, arthritis. And if you go to the doctor with any of those conditions, what do you get? Another prescription. And I've been guilty. And it's not that your doctor doesn't understand, but it's sort of that we just come to decide that our job is to match a condition with a drug and then prescribe the drug without ever getting down to the cause. And this is what really irritated and disappointed me and led to the change in my career path, because once I understood what caused heart attack, I understood that it could be prevented without the need of medications. Now the question becomes, have you got silent inflammation? And if you can answer yes to two of these questions, you probably do. Are you significantly overweight? In men, is your waist over 40 inches? In women, it's 35. Are you already on meds for high blood pressure or high cholesterol? You crave carbohydrates. You can't make it through the day without another donut or bagel. Are we more tired than usual? Do we have bad, decayed, unrepaired teeth? We have more aches and pains than normal. There is one blood test to measure for inflammation. That's called a C-reactive protein. So as you can see, most of us can answer yes to two of these, and which means we probably have got silent inflammation. Now, inflammation, the definition of the word, means fire inside. And so these are what I call my fire extinguishers, or our fire extinguishers. Most importantly is omega-3 from fish oil, and it must contain EPA and DHA. And the next thing is antioxidant vitamins for us to prevent that oxidative stress, which we know injures cells. Injured cells create an inflammatory process that ends up causing the LDL to be consumed by the white cells in our artery. And not only are the ordinary vitamins, but the most important source of antioxidants come from colorful fruits and vegetables. And we know that people who eat lots of fruits and vegetables are healthier in many, many ways. Also, we now know that exercise actually is anti-inflammatory. The skeletal muscle, when we contract, actually produces anti-inflammatory cytokines. And we know that it's important to control our weight, because overloaded fat cells produce lots and lots of these pro-inflammatory cytokines. So our fat cells just sit there and pour out these chemicals that cause inflammation when we overload them with too much food that we don't burn off by exercise. And we should avoid all the vegetable oils that we can, and we've touched on how they cause inflammation, and we've touched on how that causes heart disease.
Now, Dr. Lundell, would you mind going to the previous slide, please? I have a quick question. You mentioned hypertensive medications and high cholesterol medications. Do these actually cause inflammation, and if they do, are they the only ones that cause inflammation, or are there other kinds of drugs, or is it just these specific kinds of drugs that cause inflammation?
Okay, great question. No, the drugs don't cause inflammation.
Okay.
It's just that if you have hypertension or high cholesterol, you've got inflammation. So that's a sign that you have it if your doctor has determined you need one of those medications.
Got it. Okay. Thank you.
Good question. Thanks for clarifying. So our fire extinguishers, now you can get these anywhere. You can go to your local health food store or discount store or big box store anywhere. Make sure that the omega-3 you get has EPA and DHA. Those are the two critical anti-inflammatory components, and they come from fish oil. The flaxseed oil is an omega-3, a lot of marketing. It's good stuff, tastes good, smells good, but it has ALA, and only about 8% of that gets converted to EPA and DHA, which are the critical anti-inflammatory components of fish oil. Now, as I mentioned, colorful fruits and vegetables, I mean the skin and the color in plants, fruits and vegetables, is to protect them from the sunlight and the oxidative damage they get from sunlight. So we benefit from getting those, and in spite of everything we know about isolating some specific compound, Mother Nature seems to know best, and it's better if we get those polyphenols from our plants and animals. As I say, I got frustrated with our approach and changed my career, and I tried to get a vehicle to educate people, much like you're doing, Dr. David, allowing people to take control of their health, allowing them to not be victims and stay on the pill parade, and understand their disease process. I've discovered that the more people understand about what's going on, then the better they are to be able to control it and influence their own future. So as part of that process, we wrote a book. We created a company so that we could go give seminars around the country everywhere, and I appreciate very much the opportunity of speaking here about heart disease and trying to get people to understand the real cause is not cholesterol. The real cause is low-grade inflammation, and trying to understand what caused that. But I created a product out of this, which is called Heart Shot. If I write you a prescription that you have to take for pills that you have to take more than once a day, you probably won't take it. So when I was designing a product, I said we need to have something people can take once a day. And so Heart Shot contains the omega-3, CLA, another essential free fatty acid that makes omega-3 work better. We've got the antioxidant vitamins. We've got the critical vitamin D. We've got selenium, enzyme CoQ10. And once again, you can go to the store, get these. You don't have to take this product. But we put this together in a nice, unique package that tastes good. You mix it with any kind of liquid, and so it's a drink, which you do once a day. But please get these ingredients somewhere. And antioxidants. Everybody, I always ask people what is the most prominent antioxidant, and we get blueberries, blackberries, acai berry from Brazil or wherever. Well, the interesting thing is that coffee is the largest single source of antioxidants in the American diet.
Wow.
One, because it's relatively high in antioxidants, and two, because we drink it every day. I didn't have any blueberries for quite a while, but I did have coffee quite regularly. And so it's interesting that it becomes a large source of antioxidants. The green coffee bean has a lot of them. They get roasted out with the heat that it takes to turn the green coffee bean into the nice, flavorful, good-smelling coffee that we enjoy. And we have a triple patented coffee that we also market that the process puts the antioxidants back in. So we actually can have this coffee has more antioxidants than the green coffee bean does because of the special way we extract them and then restore them at the very end of the roasting process. Now, any coffee is healthy for you, any kind of coffee, because coffee contains these complex polyphenols that we talked about. They not only fight free radicals, but coffee has been shown to prevent LDL oxidation. And we've talked about how key that is in terms of preventing heart disease. Coffee also improves glucose metabolism, which once again will stop those spikes in blood sugar and reduce the injuries to our blood vessels. In a study in Europe, women who drink coffee on a regular basis have 50% less risk of diabetes than those that don't. And pretty good sized studies also show that people who drink coffee regularly have less mental deterioration. And we know that unlike the previous rumors, if you will, coffee actually is heart healthy. And there's a lot of marketing nonsense about antioxidants, but the key is, are they really absorbed, are they really metabolized, and do they really do anything? When it comes to coffee antioxidants, we know that they're actually more powerful than green tea in preventing LDL oxidation. So the bottom line is, get those fire extinguishers, enjoy your cup of coffee, enjoy good protein, enjoy good saturated animal fats, and you will have less heart disease and less inflammation all over your entire body. All of this information is in a book which is available on Amazon, and I thank you very much for your attention.
Wow. Thank you, Dr. Lundell. This has been fantastic information again. And for those of you who thought Dr. Lundell was just going to do a repeat of his last presentation, I'm sure you've changed your mind. This is a lot of it is really new information, and I'm proud to say that he actually, I believe him when he told me, but he actually created many of these slides for us. So we are honored that you would do this for us, Dr. Lundell. Thank you again.
Oh, you're welcome.
All right. There are going to be a lot of questions, especially about coffee. So, folks, if you have, just go ahead and type in the blue panel to the top right of your screen. Now we'll take those questions. In the meantime, I'm going to do a few infomercials of my own, but also have my own questions as well. Okay. This fantastic presentation will be available in electronic form, video and audio recording. So shoot us an email if you like to have one. By the way, Dr. Lundell, a couple of people really wanted your DVD, so we had a DVD of your program, so we had to have someone actually create a DVD. So that also is available. The first one, now I don't know, we might go ahead and create another one with your permission of tonight's own.
Yes, you have permission.
Thank you again. Thank you. Okay. Folks, remember that these webinars are available, really good presentations like this, and I have to say that this has been exceptional. But there are a lot of other good presentations available on our site, and you can actually become a member and have access to all of these. You can just, one weekend, you can just plan your time and just go through. What we're trying to do is categorize these presentations so that there might be a category on toxins. You can go through all the toxins like Dr. Lundell mentioned, high carbohydrates, fat, oxidative stress, all those things. We have them all categorized, and you can go in, you can see that topic from several different perspectives. Also, heart health. We're going to look at several things that affect heart health. And obviously, Dr. Lundell's presentation presents a core of the main things that affect heart health. And you would do well to go and see these categories. Now, one of the ways we get great presentations like this, obviously, like many of you know, is through people who are actually distributors of these companies and who do all the legwork of getting, of contacting the presenter and introducing us. And so as a reward, so to speak, I don't think we can reward Marianne enough for that, getting Dr. Lundell, but really as a token of our appreciation, we tend to send all inquiries to her. And so you will be, so if you want to get this, the coffee or the hot shots, Marianne's information is right there in front of you. For coffee, just send an email to antioxjava@gmail.com, antioxjava@gmail.com, and that's her phone number. I'm saying it out because there are some people who are calling in and do not have the privilege of seeing the screen. So the number is 952-944-4066 for the coffee, and I believe she has a different email address for the hot shot, and the email is yourheartteam@gmail.com. That's yourheartteam@gmail.com, yourheartteam.com, and I believe she has some discounted, she can give you a discount if you contact her. So thank you again, Marianne, for doing this, and we really appreciate your involvement. Okay, questions. Now, before I open this up for questions, I'm going to ask one more question of my own. Dr. Lundell, we've talked about the cardiovascular effect when things go wrong, like there's a blockage to the blood vessels. Well, how about, and I'm bringing this example because one of our presenters he's in his 80s, and I think his wife is close behind. So they've been doing a lot of all the good nutritional things and all that, and she began to have some major pains in her jaw, and I mean the classical signs of a heart attack. Well, they went in and they checked things out, and they found out that her blood vessels, her heart vessels, were perfect. They were very well and healthy. However, she had the electrical disturbance, something about the sinus rhythm out of whack, and eventually they had to put a pacemaker. I found out that when it comes to electrical disturbances, does nutrition really, or the nutritional supplements, can they really play a part where that is concerned?
They can. The upper chambers of the heart, called the atrium, that's where the heartbeat originates, and then is conducted down through a nerve into the ventricles, the lower muscular chambers. And now, irregular heartbeats from the upper chamber, called atrial fibrillation, are probably due to inflammation, because if we do a biopsy of that and look at it under the microscope, we see a big accumulation of white blood cells there, which is a very significant mark of inflammation.
Mm-hmm.
Other times we don't know why the conducting system, the nerves, would degenerate and not work anymore. As I say, we don't know exactly, but once again, all of aging basically is an accumulation of unrepaired injuries. And so I don't specifically know of a nutritional supplement that would help her right now once it's gone that far.
Mm-hmm. Mm-hmm. Yeah, it's an interesting field. Well, thank you. Someone wants to know how much omega-3s you should take per 100 pounds body weight.
At least 500 milligrams a day of combined EPA and DHA. When you go to the store, if you'll look at the supplement, on the front it might say 1,000 milligrams. But if you look on the back, on the supplement facts panel, you look for EPA and DHA, and the sum total of those should be at least 500 milligrams. And basically, some people are worried about fish oil supplements because of mercury and this and that and the other, but the fish oil actually is safer than most of the fish, none of which I think is a very significant risk at all. But the fish oil supplements, especially the more concentrated ones, that is the ones with the higher number of EPA and DHA, are very purified and clean. And when we get the fish oil from the manufacturer, they send to us a certificate of analysis, which shows exactly what's in it, how much of each thing, and shows us the levels of all the common contaminants. And we always come up zero on the heavy metals and the mercury and all the things that we're concerned about. So I wouldn't have any concern about taking a fish oil supplement, but I would always look for one that's more concentrated and one that's high quality.
Right. Good point. Thank you for a most informative presentation. What is the impact of nitric oxide on the foamy plaque? Does it have any impact at all?
No, nitric oxide is produced by those little endothelial cells, and they're chemical signals that tell the blood vessel to dilate and open up if it needs more flow. So the nitric oxide doesn't particularly cause an injury. It's an integral part of everything that goes on in there, but it's not the part that causes inflammation.
Got it. I think this person was asking because I guess they've heard a presentation on arginine and how arginine causes nitric oxide, which in turn helps to heal the blood vessels and all that. So
well, it helps dilate the blood vessels, which would theoretically increase blood flow, but
it doesn't have any direct effect on reducing the size of the plaque, does it?
No, it has no effect on the plaque at all, and so it's while it may have some theoretic benefits in terms of increasing flow, it really fundamentally doesn't change any of the processes that we've been talking about.
Got it. All right, we have someone from India with a question. However, this is a specific disease, so I'm going to try and rephrase this just to keep in, what's the word now? To remain compliant, so to speak. Okay, Dr. Lundell, what do you recommend for a person who has, well, it's talking about rheumatoid arthritis here. I'm going to leave this to you to answer it the way you feel best. The question is, will hot shots in conjunction with an additional dosage of a fish oil product help? And could these two reduce the need for the use of an allopathic anti-inflammatory drug?
The answer is yes. They're pretty good studies, lots of studies that demonstrate that by getting up to 6 grams of fish oil a day, folks with rheumatoid arthritis, which is a horrible disease to have, can actually reduce their pain medicines by half. So we know that the rheumatoid arthritis is sort of a condition where the immune system is angry and is attacking the joints and bones, and once again the omega-3 from fish oil will settle this down, will lower the inflammation, and the inflammation is and the destruction of the tissues what's given the pain. So the answer is not specifically to this person, but to anybody with rheumatoid arthritis will almost certainly benefit from increasing their consumption of omega-3.
Great. Okay, I don't see too many questions on coffee, so I want to ask one of my own. Now, Doc, I know a couple of healthcare practitioners who if faced with a patient that has a chronic disease like cancer or diabetes or one of the others, the first thing they would say, and I know someone specifically told me about this, is the first thing that he would tell the person to get off is coffee, because I guess among other things is the acidity in the coffee that would further compound the problem and would not help the patient recover. So it seems like you're given a blanket go-ahead for people to take coffee, and so would you want to clarify that so people can leave with the right impression?
Oh, sure. Number one, all of us are a little different, and if you don't tolerate either caffeine or you don't tolerate coffee or don't like coffee, then don't drink it. It's not a miracle drug. Let's get real about this. But there's lots of misinformation about coffee. We've been told that it'll cause irregular heartbeats. We've been told it'll cause high blood pressure. And indeed, these were old studies done on people who were not accustomed to caffeine or coffee. And so that misinformation got out there and got passed down from generation to generation. And sometimes if the professor said it, then I might repeat it without ever going back and examining the fundamentals of it.
Right.
And so that's how misinformation gets going on. Nobody's ever stopped to take a look until recently, and once again, there's just a huge medical literature on the health benefits of coffee consumption. So if you're not sensitive to it and not having a problem with it, I can't think of a condition where I would prohibit coffee consumption.
But with this, the special kind of coffee and the special processing, I mean, from what I understand, this is organic. There's been a lot of emphasis placed on the processing, and of course, you're putting back the antioxidants, which are critical to its function in the body. This does give one a decided advantage over the regular coffee you would get at the coffee shop, right?
Oh, it does. We've just completed. We do a couple of things. Number one, we know where these beans come from. We know that they come from a farm that's compliant with the USDA organic standards, as you can see on the label there. And we know that it's compliant with the Rainforest Alliance, which means that we treat the farmers and the workers not only fairly just with paying, but there's about 12 standards that go into Rainforest Alliance compliance. And we've been to the plantation. We know where the beans come from, and we know that we can trace them from all the way from soil to cup, I like to say. Once the beans are picked from the tree and processed, and then the green beans can be stored a fair amount of time without degenerating, and then they're shipped currently to the San Francisco Bay Area, where some very, very sophisticated and experienced roasters work. Now, nothing much has changed in roasting coffee in 100 years. Basically, everybody has their little recipe, and you can have medium roasts and dark roasts and blends and whatnot, and it's part science and most of it's art, if you will. But it's a fascinating process to see it happen. I was up inspecting that plant a few months ago and learning more about coffee roasting, and it's interesting. But the key with the Asante Java is that we take a certain number of green coffee beans, and with a special process that involves no solvents or chemicals, it's only water and temperature, we extract all these antioxidants. Then we take another quantity of beans and put them through the roasting process that we have agreed on with the roasters. And then at the very end of this process, as the beans are cooling, we take this liquid which contains all the antioxidants from the green beans, and is sprayed in onto the warm beans as they're cooling down after the roaster. And you put water on something hot, and it just sucks those antioxidants right into the Asante Java beans right at the very end of the roasting process. Mm-hmm. And these guys have been around forever, but they're really excited to have something new. And the interesting thing is that the green bean will keep up to 2 years, but once the bean is roasted, then it tends to deteriorate a little bit. But they're really excited because they have some old samples of the Java they've kept around for more than a year, and they were surprised at how fresh it was, and they felt that it was because of the antioxidant content just prevented the coffee from oxidizing in the bag or in the sample. And so we're very pleased with the taste. We're very pleased with the durability of the coffee, but most importantly, we're very pleased with a sophisticated analysis done with what's called high-performance liquid chromatography, which shows we have more than 6 times the amount of antioxidants in the most popular coffee brand out there.
Did you say 6 times?
6 times. So any coffee is good, but Asante Java will be 6 times better.
Let me think. What should I take? Well, folks, I'm a little biased myself because after your last presentation, quite a few people ordered the coffee. I got some myself, and I tell you, that's the first thing I take in the morning when I'm up, and it doesn't give me the buzz that regular coffee does. And at the same time, it just gives me a feeling of wholeness, a much better feeling. The taste is great. And I know I'm doing an infomercial now, and I know I'm supposed to be unbiased, but hey, who is? So this is good stuff. This is really good stuff, and
absolutely good stuff. I can hardly drink any other coffee if we're out traveling or something. In fact, I often take we have a sample pack that we use for demonstrating the taste, and I'll often, if I'm traveling, I'll take a couple of those and
well, how do you do it? Do you take a French press along with you everywhere you go? I mean, how do you?
I don't. I know Mary Ann's big on French press. She's excited about French press, but I just take our sample bags, which have 4 ounces of coffee in them, and I put them in a paper towel and put it in the little coffee brewer and make my own.
Oh, really? That's what you call hardcore.
Hey, if you're going to drink, why not drink the best?
That's right. Well said. Okay, Doc, let me know whenever you want to sign off. We still have a few more questions, but this is I think this is a great discussion so far. Back to the heart. Does magnesium, calcium, or potassium help in electrical problems with the heart? That's like
yes. in a word. Yeah, we have to get our electrolytes. You know, we're just a big we're just a great big chemical reaction in electrical signals, and if we I don't think you could show that if you're deficient in some of those, especially potassium, you would have a difficulty. Are they any of them what we call miracle drugs? No, but we need them, and we need to get adequate amounts of them.
Let's talk about older people. I believe older people have a deficiency, especially of potassium, right?
Often they do, yes.
And would you recommend, is that like an age place where you would recommend that they take some supplementation with potassium, or I mean, what vitamin nutrient profile would you recommend for somebody at that age?
Well, I don't have a specific age that I would start supplementing potassium. If we get some fruit, you know, citrus and bananas and whatnot, and once again, if we'll get those colorful fruits and vegetables, we'll get not only our minerals and our electrolytes, but we'll get the natural antioxidants out of those things. So if I was going to make a specific just generally recommendation, I would recommend that we eat lots of colorful fruits and vegetables, take a multivitamin, and otherwise, if you have some specific thing, you need to visit with your doctor about it.
Got it. Just can't go wrong with whole foods, right? Fruits and vegetables. You just can't go wrong with that.
Mother Nature knows best.
True, true, true. Do you recommend, we're going to have someone come talk about oils, seeds soon, but do you recommend olive and grapeseed oils in the diet?
Yes, I do. Olive oil is great for dressings. We've made a big fuss about saturated fats, which are completely erroneous. The bad fats are actually the ones that we've been recommended to eat, and that's the fats from vegetable oils. But an olive is a fruit, actually, so most of the oils that come from fruits, such as olives and nuts, are pretty good stuff. So olive oil is good. Coconut oil is great. And so, but if you're going to cook, then go back to what Great Grandma did and get a bucket of lard and use that.
Okay. At what cholesterol levels would you? Okay. At what cholesterol levels would you prescribe cholesterol meds to someone taking 6 grams of fish oil per day?
I wouldn't prescribe anti-cholesterol medicines for almost anybody.
I was afraid you were going to say that. Actually, I wasn't afraid. I knew that you were going to say that. Okay, well, there you go. Is oatmeal good for you?
Oatmeal's fine. If you're taking it thinking it's going to lower the cholesterol, you're wasting your time because cholesterol level doesn't make any difference. We've covered that.
Wait. How about Cheerios? Will Cheerios reduce cholesterol for you?
Cheerios drive me crazy for 2 reasons. One, they say it lowers cholesterol, and that's really a drug claim. And Cheerios has been warned already by FTC and FDA, but the ads are still out there.
Oh, really?
They call it a whole grain, but I've never seen a Cheerios field of Cheerios. Have you?
No, I have not.
So a kernel of oats is a whole grain. The Cheerio is a big lie, and it's just. And we think whole grains are better, but they actually, when we grind them up, they get absorbed very quickly. And white flour, even wheat flour, although we think it's healthier, gives us exactly the same amount of carbohydrate absorption as sugar does. They're almost the same. So if you're going to talk about whole grains, you have to get the whole kernel. None of this ground up nonsense. It's just nonsense.
So that's an issue. Whole grains are probably they are pretty much still high glycemic. Is that what you're saying?
Yes, they're still high glycemic. If they're ground up. Now, if you get a handful of wheat and chew on it, I don't know if you've ever done that.
Nobody does that. Except if you're in the Middle East or somewhere. Yeah. So, well, I think the emphasis should be more on fiber than really on whole grains, because I think fiber is really what helps.
Well, fiber fills us up. Fiber gives us satisfaction, so we don't eat too much. And once again, Mother Nature knows best. We've heard a lot of stuff about fructose, and fructose is the sugar in all fruits. But when Mother Nature gives us fructose, Mother Nature always gives it to us with lots of fiber, so we don't eat too much of it. And
right.
So once again, Mother Nature knows best, and we're getting close to the time that we need to say goodnight.
Absolutely. Well, again, folks, this has been a wonderful presentation by Dr. Lundell. And Dr. Lundell, I thank you again. I know we'll be having you on sometimes in the next couple of weeks or months when the coffee thing hits the fan. Well, not hits the fan. Excuse me. When the word about this wonderful service that you're providing becomes better known, we will have you back on. And thank you so much for taking the time to do this presentation and put it together.
Oh, thank you.
All right, folks. Have a great evening, and we shall see you on Thursday for 2 presentations. God bless. Have a good evening.